This program is brought to you by Emory University.
Tamdin will speak in Tibetan, and our resident scholar, Sundu Sambel, who graduated from Emory University and is now serving as the chief translator for the Emory-Tibet Science Initiative, will translate. I extend my heartfelt greetings to all of you.
And the Tatari de Pepe Kunduzo, Donald Paul Tang, any Emery, Tologi, any Lapruta, any again number so, I'll have what to tend the per tang, pergi, any Tereki, any Karsure, Tembegi, any Karsakinzi, Kolosanzila, Cho, Derby, any Miman Samuel de Taride, and Chibunam with any some details.
Dr. Robert Paul, the Charles Howard Candler Professor of Anthropology and Interdisciplinary Studies, members of Emory Medical School, Geshe Tsewang Tamdin, the Director of Emory-Tibet Science Initiative, and all the distinguished guests. I'm very happy to be here to talk a little bit about the Tibetan medical tradition.
제가 다들 주시조 디 다지데 롭사텐질라 초고 고renangbadi 아니 가지 이게 돌마 아니 데메체 유스 안 델야 시로낭스 안디 강리야타 카르소르 벽소릭바디기 다타둡 신난다 아니 소릭바디기 아니 펜제 간데요메 아니 나레기다 다 암지신로 숨주 탐베낭로라야 아니 벽소릭바 라렌체베 냠뇽고 통네 아니 가르쳐오래지 나제기 쩌답 나제 뭔지 안 델리아 냠시 통네 아니 지 제나야 마음바 편제 가르면 니콜이야 아니 내주도 두든지 슈기스.
Yes. So I've prepared a written speech that has been distributed to all of you. So the main gist of my talk will be from that written speech. However, I'm going to speak from my speak about the philosophy of Tibetan medical tradition, its history, and from my personal experience as a Tibetan physician. I'll be using examples and instances from my own practice to highlight some of the concepts. And also I'm going to talk about our future visions. Excuse me.
타치랑 베베멘디리아 가르치는 소릭바시요레스 베베멘디 소릭바시디즘바 가리소와타 가리소와딜이야 아니 릭바 가리탄제 아니 menju 치고해지요 디인자 베네 자가기 메슈나르 세릭제 치게메라 알로비디데 라반낭시시니 베베멘시딜이야 아니 벽이 소릭바시니 소릭바시디 베베멘기릭 슝게다 밍디레스 디야 아니 링네체방아이나네 아니 링네체바 찔이야 뭔지 치고레스.
So the Tibetan science of healing is generally known as Sowa Rigpa, just as the Indian traditional practice of medicine is called Ayurveda, and the Western healing system is known as allopathy. The Tibetan system is known as Sowa Rigpa, and I'm going to talk about the methods of diagnosis and treatments, and what is mean by Sowa Rigpa, Sowa as in healing and Rigpa as in science. And Sowa Rigpa is considered as one of the 5 major fields of knowledges in the Tibetan culture.
팅상 아니 가수래 치게멘디 알로베티멘디 쪼도숭 아니 셴베기다 traditional sinada rikshungi any soje rikpatizolata alternate medicine sietida shesuji yores inaya pegu sowa rikpati ani chidangi karsugure nganjogi shunglu jachi jagap shemba 자가다 아니 재미다 딘조기 아니 소거릭 베기 리슝다 마다와치 카리어스나 베베기 소거릭 버디다 고기 나자네 아니 메 강괴 파툴라 류데 셈니기 나자레 쪼다 angos yuebeki ta rigbegi shunglu yang thapachi da ani chede dembaji ya ani ngonji chebayina ani madiga kheyo mares ti nganju lagle nanglo la ya an ti ti singi de sungbandang si chini ani lagle nanglo ya pendong jinji yunggu yobati ta tingsang nganju cheri thone en nyamchi chiri de ma hakku ngores.
Generally, there is a perspective that the true healing, the science of healing, is the allopathy system, and other traditional practices of healing are considered as alternative medicine, and are often considered as a sort of side practice. I want to emphasize that the Tibetan healing system has its unique philosophy. It's grounded in a profound philosophy. Has a complete sort of set of diagnostic techniques, treatment techniques, and so Tibetan healing system could be considered as a full-fledged science of healing.
제자 디 따베기 단다스 베고 소와르버디 아니 낭베기 따둡다 투유샤바 아니 가레와르시나 나란조그 미디 지시상게 마데파둘라 아니 미수분나로야 아니 가르쳐 마릭 버싱디 여베인자 아니 나란조 내가 만나바이나야 나자 사이가 유조디 아니 간조기 수국이 셈나나 내대요레스 아니 디기 유도 조디 가레시나 아니 담은 되번도 마릭 버시데 링귤이야 페션 세기요레스.
Now, Tibetan medical system is grounded in the Buddhist Buddhist philosophy, in the understanding that the sufferings, in the understanding that the illnesses are caused primarily by the ignorance. It understands ignorance as the root cause. And as long as we have ignorance within our mental stream, as long as we have not overcome this ignorance, then the root cause of sicknesses, root cause of sufferings lie within us. And no matter temporarily you are okay, you are in good health, the main cause is deep within you. And as the other factors and conditions get together, then you have the potential to get sick and suffer.
다디 빼디 가리를 차샤거나 빼네 차다부 차샤버이나스 차디 남라야 가지 풀버이나 풀토부요레스 이나 차디의 냠도라 코 팀나디 가두이나 예요 말레스 제장 가란조 수구 대부지 대비 내가 비난다 나비 내가 비난다 당면 대번도 마리버 딜 양간조 당진 빵마도다 마리버디 빵마도 상계 고마도 바이나 아니 디게 가자 마리버디 가두이나 가주 셈나라야다 팀만 능지체 팀나 샤도 능지체네 아니 간준들 네 여자 아니 당지 될 때제 아니 녀모 도자시다 띵무숨데 아니 게용거레스.
Yes. And this ignorance, which is the root cause of all the diseases, can be overcome only by a wisdom, understanding of the selflessness, that things do not exist independently. Things lack independent self. So unless one gains this understanding of selflessness, one won't be able to overcome the ignorance. And so long as you have ignorance within you, you will continue to suffer, you will continue to have problems. And the one metaphor that's used to understand this is the bird and its shadow. So the bird may fly, take off from the ground and fly high into the sky, but it continues to leave a shadow on the surface of earth. So similarly, as long as you have ignorance within you, no matter whether you're enjoying a good health now, there's always a shadow of sickness falling upon you.
다 디니 당간족의 도자시다 띵무숨디 다 마리판에 깨버리 시고레스 도자를 때니 룽 시단을 때니 티와 백인을 때니 아니 그 띵물을 때니 백인승이 단 예발룽디 백인 숨지는 건조리게 시고레스 디 나란서 대댕이 미상맥이 셈낭다 수구나로라 요요바레스 디 매바 미수지에 대요 마레스.
Yes. And from this ignorance arises what are called the three mental poisons, which are the attachment, the hatred, and the delusion. Sorry. And so out of the ignorance, the three mental poisons arises, and the three mental poisons affect our system through what are called the three humoral energies or three humors.
다디 룽디 백의 숨디 뇽바 중나 아니 간족이 누길래야 셈다 수분이디 냠돌래야 아니 레가치에 직제 아니 미기 체내에다 아니 미소네 투부요레스 룽디 백의 숨디 녜바디 만뇽바이나 뇽만뇽세지 다 녜바뇽나 아니 류네메 녜바만뇽바이나 내제스네 아니 직디 표주단거레스.
Now the way the three mental poisons affect our system is through the three humors, and these three humoral energies or three humors are the bile, the phlegm, and the wind. So these are three technical terms from the Tibetan medical text, and through these three humoral energy, the well-being of our health, the well-being of our health depends on these three humors. When these three humors or humoral energies are in balance, the person is said to be enjoying good health. The person, his sort of life force sustains. But when the three humors are out of balance, that's when we start to have problems, sicknesses, diseases, and so on.
다디 만뇽바디 가리 둠제를 때는 뇽구요 말이스 라바이나 텔리아 간주 나제게 켄시 세요레스 내용에 켄시 켄데 테나 아니 데부딜이야 아니 주딜레 데부징그리 켄데 마테바나 주딜레 데부징기요 말이스 켄 상부지데 테바이나 아니 루데보 용바 켄게 바지데 테바이나 마데베 남들이 용해바디 춘이레스 이나야 메슈 나로라야 가르시야즈나 세다 졸람 직제 두둔 싱지요와 디게디 아니 나자 용에다 니발룽디 백근수 투에게다 겐소디 세다 졸람니 디간라야 아니 두제 아니 튼시 따딘데 시게제 지니나 바시디 아니 나자 용세게다 나란 상멜라 아니 겐디 디진 태제 아니 나자 디스나 룽디 백근수도 뇽고요 마레스.
So the question is, when does this the balance gets disturbed? And in the Tibetan medical tradition, 4 factors are recognized as factors that disturb the balance of these humoral energies. And when the factors get together, then the root cause, which is the ignorance that lies deep within you, is stimulated in such a way that sicknesses are produced. And these 4 factors are 1, diet, 2, lifestyle or one's behavior, 3, seasonal conditions, and 4th, the mental condition. Evil spirit or harmful forces.
제스타 튼세들 단 욕도 망보요레스 기란조 튼싱인데 뭐 징기요나다 매난다스 디 무슨 네바카셀이야 히스테리아 싱에 나자직다 셈나라 나자요데기지 아니 홉트간이야 딘데시 미데마 탕마지리야 람상 아니 심 마데바차 아니 깨잡 아니 뇨조 부조체 아니 소부바디 야 툭야이 딘데 나즈직 단 예장아데 마용코네 네버직 딘데 로보드 중버지 종성스 델리아 나레 록바 아니 지게 암지지 요레스 맹글랑레제 코랑기 나즈들 히스테리아스기도스 이나가주 베베메나야 델리아 드스 슈퍼레스 요레스다.
So, of the four factors, the most difficult to accept or understand would be the last one, the evil spirit or the harmful factor. But the Tibetan medical tradition accepts that, and there are cases where, for instance, cases such as hysteria, where it's very difficult to come up with a good explanation of how that's happening and why that's happening. Just recently, I saw a patient who, without any sort of reasons, started acting insane or crazy, and this was diagnosed as hysteria by one of my friends. But according to Tibetan medical tradition, it would be considered as caused by the evil spirit or harmful factor.
다디 튜든 세주 땅 아니 딜레께 제제 예벌룽디 백인 숨디 가르치고 있으나 룽페바 세바 툭바시니 남숨 아니 주니 차루거레스.
So the way these four factors influence or affect the humoral energies is primarily through three ways or three mechanisms. One, by enhancing or increasing these three, either of these three humoral energies. Second, by reducing or decreasing the three humoral energies, or by disturbing or causing disorder within the three humors. So that's the three mechanisms through which the humoral energy affects our system.
다디 페바 세바 툭바 숨디 땅 간데시니 딱제 제제 아니 코 페기도 세기도 툭도 세데다 베베기 문지 딱세지요레스 나자디다 간데시니 문지 지워 베네 치게도 부지 차샤보는 치루메도 차샤나 다 딱제지에 아니 가르치고레 단지 투제 망부 표조 땅제 아니 나정문지 지에다 딱제지에 요레스 이내양 아주 베베기 맹기 슝루 나로라 따바 렉바 테바시니 좀제 숨기 토네 아니 간족이 나제디 아니 딱제지 그레스.
Yes. Now, how do we find out the energies are disturbed, or how do we what is the diagnostic method of finding out whether the three humors are in balance or not? In the allopathy system, you have various instruments, you do blood analysis and so on to find out the causes of diseases. But in our traditional practice, there are three ways. One is through visual analysis, looking at the patient. The second one is through contact or reading pulses. And the third one is through interrogation, asking the patient about his conditions and so on.
다디나네 지 따왔다 렉바시에디다 개치주 시부지레스 디 출을 따야지다 잘을 따야지 요레스 다디.
Now, in terms of the visual analysis, there are two main techniques used to do that. One is the analyzing the urine analysis, and then the other one is pulse reading.
다디 딱제 디기 가르치고랑 중군지 딱이 다지 따와 레포치브 다렉티브 숨딜 때제 아니 간주 나중 군지 지에다 빼나 차샤고이나 간주 지얘기 낭라야 딱제 지마투바지다 베베기 맹슈나 딱제 지투베기다 나좀 망부시부죠. 그래서 간신나 간주 베베맨데 치루맨데 이게 직번 멤버 송장 아니 지얘기 다지 룩 맹기 슝루딩이 시부 신기다 말데 이나 디게 참말로 무슨 세마때는 펩샤교기 다 제메게 돈에 지기 파게 통주 요기 릭질라 다 나자요 방문지 될야 면제치 두고레스 이내야 베베기 메기 슝나로네 롱리 베게 숨세 칙디 나자디 다 수군나라 나자 빼망보인고레스 베나 내리시겠자시 예리 동다 자주 신이게지시고레스.
Yes. So one fundamental difference between the allopathy system and Tibetan medical system is in identifying diseases and sicknesses. In the allopathy system, most of the sickness that are identified are empirically based, in that those that you can observe either with your naked senses or through using some instruments. In the Tibetan medical tradition, there are many sicknesses that are identified which are not empirically evident. We in the text some 8,400 diseases have been identified, many of which cannot be observed directly through our senses or using instruments.
In the lungi naza singing the chashakbajinas, lung singing this semi naza yimbachi, lung lea lung ring matanga yores, lung sonzing kinju chapji minyam tuses in the ring mara nabanga yor, in a lungi naza di chik two shadizamba, sim madiva chava di wangi, ani subu nanglolea ning dang, ani subogi karsa, po juma long, ani did the deva yobege, ani karsure ganju subu nangloge chik trushe nyamdoye. 아니 찹상 가도야 딘데기 내주 망보지 룽구 주었다 다카르소레 룽기 젤레디 아니 페버다 세버도 투벌 때제 아니 딘데 용두 잠바 베나 미더부지나 수분낭로야 베나 나자도 차샤고이나 다 딩산 tum부소로 지어레스 치루기 델레야 tum부기 베나 녜 삼삼로야 디 인터넷 따두 잠바 tum부미다 릭 야스지 에와 셰기도스 이네야 당룸싱에 차룸싱에 딘데 릭 딘데 카셰지 요레스 pena sim nang lo la ya sim ma ji bi na za yo ba da sim lung le de ni su bu nang lo la ya ji za gi na za yong ya ke me na za yong thang we na za yong ge mang bu shi bu ji yo res dige di ta nebal de su bu de le na za yong go res ani na za yo ba di ta na za di pha ji tak je chi ga chi ni am ji de le pha du du jam ba de se ja be yo ba ji la ani thong ye me ba ji la an di sim gi nam do gi na za res ni ta ting san din de si ni 제제 될이야 면제 하나 매비 소리지니 샤샤고레스 tumbu다 룽데 되어이나 저지어와 탕웨나 저싱도 좀
Tumbudi
arthritis 릭질음나 되고 cold arthritis for example lam나 되고
yes. So for instance one of the three humoral energies is the wind energy, and 5 different types of wind energies have been identified in the Tibetan medical text, and the disturbance of any one of them could cause problems in the system. So the disturbance in wind energy can cause the person to have mental problems, heart problems, and in other systems such as the digestive systems and so on, can cause constipation and so on. And so these problems are caused by disturbance in the wind energy, and this is identified by the Tibetan doctors. Read pulse and are able to identify these problems. However, the cause or the factors of these some of these problems, the symptoms sorry excuse me, the symptoms are apparent, so the patients are able to describe their symptoms to their doctors. But then when the doctors try to find the cause, often it's very hard to get to the to identify the real cause, because the disturbance in wind energy is very hard to identify through using these technology. For instance, cold arthritis. When I look up the arthritis, I find that there are about 100 different types of arthritis. But in our tradition, in our text, cold arthritis and hot arthritis are identified, which are primarily caused by disturbance in wind energy. And these are the Western sort of medical tradition find it hard to pinpoint the cause of these conditions.
다 딘데기 리기 나자요 직스 페날룽이 나자 임바체로와 아니 둥부 나자요바 아니 디 멤베게다 티바다 딘데 침바다 딘데나 나자다 담마다 망보여 탄디 라바나지 네리 쉽게 잡시시지 요리스 디낭라야다 맨주 지에 딜야 페나 둥부도 차샤보이나 만주 지게다 다 룽바 가사칼 도디 좀바 나자 나바디나 망부 시부질야 맨주 다 지루기 다 맨주 수자 맨점 때바 마도지네 나자 딜야 맨주 요 마레스 딘데 세자다 수자 맨디다 미즈코라 사고르스 딘데 게시 데고레스 이네 딘데 릴야 페베 맨세제 아니 파잉에 망부시라 중요레스 티디싱기 따셈기 나자 요바 그나 디와기 차샤베나가 디와 용바이나다 네버도 따디 좀 버니 가르 통거서 디와리아 셈기다 셈네기 나자딘데다 룽기 나자세징은 좀 베베시고 디나자디 자주는 무슨 자주 토부시라레샤 스페는 눈주 동안 자주 캔한 자주디 용구도 데 가르치는 연구하시나 세다 줄람 룽베네당 레게기 네당 딘데질 때는 연구하리 이내 델리아 면주치에게 탑람지예요 말이스 가르치나 니쿠의 메사 주지다 셈바파 갈수그러지 다지 요르와 중부요버디다 마 미르마스는 내미기다 맨딘데 지기 테이블 마도지니 니 나즈딜 파 타도야다 양로도야다 아니 지기 시도야기 엔 탑람딘데 메버딘데 인상 아니 베베맨디기다 단다버들라 베베맨디 깨라침보 용에 단다버들 베베맨이야 가부치기기 엔 네버 망부시부지 딘데기 냠냠 토네 아니 면주하고 지부지 지투구요디 베베맨기다 연된다 캐주 안 지기 루데 셈니기 나들야다 펜도 여바 류기 셈는 류니절 데바여비기 나자 임바지데 베베멘슈는 로동다 숨시군이야 아니 류데 셈니디 냠돌 내가 지고르마 디니 카가 마르신 시기오레스 줌젠디.
So these conditions, some the mental mental problems, which are the result of disturbance in wind energy and arthritis, and many of these conditions are often diagnosed as such, but there are no treatments. And for instance, for arthritis, cold and hot arthritis, the only sort of medicine that one can take is mostly painkillers, to reduce the pain. So these analgesic medicines only relieve the symptom. They do not tackle the main cause of these diseases. So there are many diseases which are which only have drugs to treat its symptoms, not the actual cause. In the Tibetan medical tradition, arthritis is treated, not only treated its symptoms, but also the cause is identified, and then as a disturbance in the wind, and then medicines are prescribed to to sort of change that imbalance, to bring the balance back. So therefore, these conditions, especially in the West, people suffer from various kinds of mental problems, mental depressions and stress and so on, which are often brought about by their lifestyle, by their diets, by their work conditions and so on. And these problems are often treated by giving antidepressants and so on. Medicines that only treat the symptom and not the causes. So the Tibetan medical tradition has a rich sort of practice of treating many of these conditions. There are and treating the very causes of these conditions. Because of this, because of the sort of complete perspective on the disease, Tibetan medical tradition has been very successful in treating many of these problems. As such, many of the patients they rely they rely on the Tibetan medical tradition, Tibetan medical practice, and as such, this practice has gained popularity in throughout the world, and one fundamental difference or one fundamental reason for such a success is in its complete sort of perspective, in that the medical system not deals only in the physical system but also the mental system. So the physical and mental are integrated in this tradition, and as such, many of the diseases or problems are treated not only at the physical level but also at the mental level.
nganjugi naza khandeji na menju chiela nganju se chu menje ani shidi ni nganju khatuinege kharsore di pujodangje ani naza khandeji na menju chigores ineya seju menje shi ganglaya ani ta kharsore nganju gi yora gom nyamnen chi ye yora dijute ani samjam ji gi thone ani nganju bebemen di nanglo deba shukchu chagi yores 간신은 지디 낭로네 아니 수부 낭로야 지 카제게다 지라 이제 지고라 카제 이제 지고 말 이내야 아주 맨디 다 홀리스틱 어프로치에 디레스 제제 디 인디좀 디 낭로야 나란주 수부 나라 나제 디도 카리체 중반나 고 주데기 망부 시부지 태제 아니 아주 나기요 왠자 주데기 디니 아니 아주 못쳐제 아니 디 갑자기 카리미디 바자투웨나 아니 나제 카리나 다예요 직시요레스 이내 가시지 다해요 마디 레기 나자려야 아니 간주 제기월에 간터냐 간대지 나와 있는 데려야 탑다 람메버 자원이네 말이스 요레스.
Now, in terms of treatment, there are four different types of treatments. The first is diet. The second is behavior, to have proper behavior. And third is the actual prescription of actual medicines. And the fourth is accessory treatments, such as moxibustion and so on. So these are the four types of treatments used in the Tibetan medical practice. And on top of that, to complement that, the contemplative practices such as doing meditation are also recommended. And one unique feature of Tibetan medicine is its sort of reliance on the Tibetan astrological science. The two are often practiced together in the practice of healing a patient. So that therefore, this medical system can be viewed as an holistic system. Its approach as holistic approach, in that it treats the body and the mind together, and the sicknesses and diseases have so many factors, so many conditions. It's not just one factor that's causing it, but so many factors come together to in producing these sicknesses. So our tradition has the practice of considering all the factors, all the causes that are in producing this sickness. As such, this system is a holistic system, And of course, there are diseases that cannot be treated. This is also identified in the text, accepted in the text, and these diseases are often called lene, which means diseases due to karma, and as such are considered as untreatable.
le imbaina le chuche yores le chude never tawani mares.
So these diseases that are primarily because of karma can also be remedied. There are ways to overcome the negative influence of these factors.
아니 베베기 맹기 돈에 다 주담 낭로라 텐데 매자의 생기도 팅사 radiation 담에 따고 찍고 찍한다고 그래서 디카가 개개 말이스.
And of the four type, the fourth one, accessory treatment, includes practice such as moksha bashan, right? And from one perspective, it seems this has the practice of moksha bashan is quite similar to the radiation therapy that is used in the Western medicine.
아지나 디 메디 만족이 텐다 데이터 tumbu다 짜가르다 아니 답차리 루고기 칙망부 피와 아니 케메기 퇴쇼와 딘돌이야 갑두잠바 매직 갑두잠바 로 주정원디나 만나게 되네 용거레스 딘데 menju 체베이나 그 잡에 매직마도 자고고 말이네 에펙트 되게 용거레스.
So the moksha bashan, for instance, is used to treat problems such as tumor, cancer, arthritis, the kidney problems, and so on. And when done effectively, this way of treatment can have long-lasting sort of impact, such as when the kidney problems are treated through moksha bashan, the patient recovers and enjoys good health for a number of years.
다디니 팅상이 나자 깨라첨부 망보 요레스 벤나 자가기 나자 MS 싱이딘데 직 다이아베티스 싱이니 블러드 프레셔 숨 아니 다디면 베게 데네기 릭다 다드마다 망보 요레스 디주 나로야 탄다버들야 땅아도 우지 차샤보나 로 숨주 소숨기 땅아 스페셜라이제이션 게 말이스 나자 제작버지기 암지 게 말이지 나 녜자를 용에다 네버 니마리를 네버 둔주 자주 니마지를 참자 네버 자스틴데 니 딱이 요레스 이내 네버 디게 상물로 나전 닝바 맨주 제니 마펜조 망체버다 우지 레스 이내 디줄이야 베베기 다지 소릭비기 슈니 세바나지 따릭 티바드 약보체 맨주 세주드 약보치 아니 미소속에 컴드 튠베기 아니 맨주 지투바이나 강사 레레레야 베나 고네버 미니요나 나제 직발에 고나바 이나 코란 얘기 나제 고나 유겐디 미레레 로가레레레스 제제 딜 체제 아니 베베 맨주 시디 좀 아니 타기여버다 베나 미그린 싱에 고나에 등사 고네 자가 지도 딘줄레 차샤바이나 딘데게 돈 아니 시부지 맨주하고 지투바딘데 중제 아니 야부 응거레스.
Yes. In my excuse me 33 years of experience, 33 years of practicing Tibetan medicine, I have seen a number of patients. Many of them came to me when they don't have any other alternatives. I'm not specialized in any particular disease, but I consult and see patients, sometimes even 100 a day, in general about 70 to 80 a day. And many of these patients, they come to me, when they have ran out of all the usual sort of treatments, and so often my patients, many of my patients suffered from diabetes, multiple sclerosis, high BP, and cancers, and so on. And the way I treat them is on individual basis. Even if two patients come with the same problem, for instance, migraine, I cannot prescribe the same pills or same medicine for the two patients, because the prescription of drugs or prescription of medicine depends on other factors, such as the person's lifestyles, his dietary habits, and so on. So even two patients come with the same problem, they have to be treated differently, or each patient is considered treated individually, and then medicines are prescribed, but also as important are the prescriptions of diets and lifestyle, and so on. So from this holistic sort of approach, I've been successful in treating a number of patients who are at their sort of last stage.
다 줌제 딘데 차네 아니 베나 베메다 아니 칠루메니 냠돌이야 다 냠시도 제베이나 아니 나제 딘데 소로딘데 망보질이야 베나 tum부도 차샤바이나 싱간주 참sam마다 menju치디점바 속시부 야기도나 아니 간주메인디 속디 자에기 미유케 말레스 나제디 자에 미유레스 자제 속시부 야기도나 아니 속자메사스 아니 베멘디 슈글 땅스 추도직 바루샤 살라비나 팬도 충분히고 용거레스 단니버들 탁시 토보 유비 네버디네 망보여도 탁시 맨디 숙충부서디 기 케메가나 마포 아니 슈구슈레 케메 토라도 아니 레프라이티 심룸디 망보 용데고레스 딘졸이야 베베멘 디즈낭로라 카투 이네게 속부소에 아니 하고도 동원으로 소소소소게 간진 뭐 소소소야 소야다 소소 뉴바 게투비야다 소소소게 최세지요레스 최 디 지게기 메낭로야 트여시리도 믹세기 숙충보다 도나 숙충부 개요 말레스 이내야 만주낭로라 케메 트연냠샤 강베 트연냠샤 세기 내주 망부 시부지요 디 아니 하마고 와찬에 나 prostate cancer, bladder cancer, kidney cancer 디 망부 지딘데 토네 가시는 룽기 디바지 아니 룽기 닝마 디용바다 아니 룽기 낭로기 갈스고레 케마데 딘도 칠레게 나올라 멤부다 딘도 타 쪽버서데 딘데기 내가 망부 지구요바디 간주 신고자 간주들 면조진이 자기도 스케지디 셰기요를 마도진네 야 지게면에 야가지 간주면에 요르게 셰기요 말이 줌제 디나는 다 망부시우지요레스 나제기 줌제 다 디죠데블이야 아니 탐람 다 차단이 예버체지 쪼버딘데 지그레스
So therefore, these two systems, their philosophy is different, their approaches are different, their methods of treatments are different. So a collaboration between these two systems would be highly beneficial. I see it highly beneficial. For instance, in problems such as arthritis, the Western medical doctors prescribe pain medicine, which is okay in reducing the symptom. Even in my practice, I prescribe pain medicine for people who suffer from arthritis to reduce the symptom. But then, we also give other medicines to to treat the main cause of this problem. So such synthesis, where you use both Western medicine and also the Tibetan medicine, can be very effective and beneficial in treating these problems. Then another example would be the patients who suffer from high blood pressure. When you take the Western medicine for high blood pressure, sort of prolonged taking of the medicine would affect the kidney and may lead to complications, kidney complications, such as nephritis. So in such case, of course, the BP medicines are prescribed to bring down the blood pressure, but also we prescribe Tibetan medicines to sort of invigorate the kidney, so that the kidney would not lose its function. So similarly, other problems such as various types of cancers, prostate, bladder, kidney cancers, these are also these can be treated using the practice of both the allopathic and the traditional Tibetan medicine. So I see a huge potential in bringing these two systems together in developing collaboration work between these two systems.
다 단다양 안주 냠시 망부 도심바레 도 차와레 도심바레스 디낭로네 hepatitis B 아니 peptic ulcer 아니 가르소레 hepatitis C 딘데체 안디간리아 단다 디시어와 가르소레 케마체 tumbu 딘좀 나라야 아니 stem cells 하고도 디주나라다 tumbu 냠시 도니 안 펜도 망부시부지 연구에 wen자 단도 이내다 먼저 나저 망부시부지래 냠지 냠데 지토웨이나 아니 펜도 망부 연구에 가지다 금제 망부지다 계제 망부에 가지가 통구도 아니 단다 에머리 나라 다라 셰나스 코랑게 냠시지 도심바레스 잠시 도버딜이야 ngara simbala thunde ya bushimbushi mingre samgudos ai maungba ine tanda Emory University ta ani menji khang di institution ni di an nyamdole ya tunjur ge thone ani medung ge thone 다시 공도 쉬고 나지 나자 치루 그릭베 딱제 치마 투발라 아니 베베 그릭베 딱제체 아니야 치루기 가르치고래 맨저 치마도 베베 맨기 딱제치 맨저 치투비에 따 딘데게 토네 나자 망부 쉬부지 다나가도 냠시 지규 제심벌에 지규 대와 망부 쉬부지 어레스 아니 창문 냠돌이야 무든 제제는 냠시지 쥐투바이나 마음바나 아니 가르치고래지 릭바티 지 yargya tangye rikpa savalebye ani lobjong phazu jelenchi ani lobra phazu ji jile ya kharsule shungjangye da dinde thone da mi ji dobegi da jizo nangla ya ani devattuye ge tablam dele ani tafi yabuji gandu situgure samgudo 제장 아랑군에 delya ani 이제다 듬바타 dinde cheje ani taride mixukani ani kugab dinang je hele lunch nangbadi 할레베게 가딩 심보다 구십다 아니 통제 신부시다 총스 가부 총스 투지시 슈일 하바도 마음반에 디인디 릭딩한 적이 있다 레시디게데 무튜니 아니 대바 지투비에다 아니 냠루 지투베이나 아니 시라기 아니 팬도 전부다 야구 연구를 삼기도 아니 다리데 지빈나오니 엔데 주드 따직멘스지데 게제지시니 님빈이 데버에 니 강에시다 중국이나 데려양에 공다 아니 투체 나스 데버디.
So the Tibetan Medical Institute based in Dharamsala have done many collaborative works, many researches on diseases such as hepatitis B, hepatitis C, peptic ulcer, arthritis, and so on. And the results have been very encouraging. And I really hope that more collaborative works will develop in future. I mean, each tradition or each system has their own pros and cons. Tibetan medical system, of course, have limitations which can be, helped from the Western medical traditions. So I really hope that more collaborative efforts will take place in future. Right now at Emory, in Dr. Ray Shanazi's lab, a study is going on. It's been going on for 2 years, and I really hope that good results would come from that study. And when I was invited to talk at this luncheon by Halle Institute, I happily, accepted it, because I thought that, it's a good opportunity for me to introduce the Tibetan medical practice and learn about the Western medicine, and also start a discussion about ways to create new collaborative sort of efforts. And both the traditions have the same goal of improving the humanity, to work for the betterment of humanity, and this single goal can and should bring the two institutions, the Emory University here and Tibetan Medical and Astro Institute in Dharamsala, together to do more studies and more collaborative efforts. So I want to thank the Halle Institute and the Halle Institute for giving me this opportunity, and I want to apologize to all of you for making you listen to my
Long
1
CD.
hour talk.
Thank you.
Thank you. It was what a great lecture. I'm sure that you have some questions. We will have cordless mic there. I know that we have to stop at 1:30. So if you can raise your hand, and there's mic there, we will go until 1:30. Before we take the question, I just want to take this opportunity to thank Halle Institute and the Office of International Affairs, particularly Halle Smetko, the Vice Provost, Evan Goldberg, and all their staff at the Halle Institute for hosting Dr. Tamdin for this talk and for their support many years for Emory-Tibet Partnership. Thank you.
Thank you. I'm a physician who's been here for 45 years in traditional medicine. And our culture, the way our medicine works, is it's very monetized oriented. In other words, if you can come up with a drug and make a lot of money off of it by patenting it, then you can make advancements. Some of those drugs are valuable. Some of them are not very valuable at all. They might extend Alzheimer's by a month and cost $40,000 or whatever, $50,000. I think one of the best collaborative ways we can work together is to take, through the internet and various other mechanisms, the people who live the longest with different diseases and do the best, and study those people and see if we can learn from the people who do the best, no matter what type of medicine they get. The people who would pay for this are very rich people, like Steve Jobs, who had pancreatic cancer. If he could have put his hands on the 200 people who lived the longest around the world with that, he could have put $50 million into it, and there would be a big collaborative. We have somebody with Parkinson's who started Google. And this collaboration to look at the people who do the best rather than how you can make the most money off of the discovery. I wonder if that type of collaboration might be worthwhile. We're exploring it here at Emory.
Tadi samjushra ya koreswa an die nganju dele ya chi tona yo dinde yores ina nganju di cheba cheje shugule ya nganju rimbe betagi is ani shira samju ya kodus.
Yes. Dr. La agrees with you. It's a really good it would be a good approach to seek those people and try to find out what are the factors that are helping them. So we would be interested in this kind of collaborative study.
Would you repeat 5 energy system again, please?
5 energy. Maris tini energy. Ale long sonzing ki gyuru kyapje minyam turse labres. Telia thangbudelia life sustaining wind energy. Ale okay. Life sustaining wind energy, pervasive wind energy, ascending wind energy, descending wind energy, and fire accumulation energy.
I wanted to thank you for a very interesting lecture. While you were speaking, I thought about the idea that we have in Western medicine of family history. Often, before you see a doctor for the first time, you are asked many questions about whether your parents or your grandparents or your siblings had a certain disease, and sometimes people who may have the same disease are treated differently based on this. I was especially attracted to know if there's any relationship between this and the Tibetan idea of diseases due to karma.
In a Kashalia and Migi, the family history that in the genetic nazit in the Yoris, you don't see what is. Kashalia Nangjila Saya, Dungi, Day, some Chipochitizamba, Kolungi Pegasumgi, Kamji or Kunyumbuchumizamba, Lungi Naza, Togo Nazat in the Chipo Young, but in the you don't see what is. In a young but Chipo Chigi, Talia Menjo Majas, me sources of Rangshin Kande, Medelia Teje, and the Menjo Chia, the Pevegi Mixcar will casual race.
This the tracing of family history is also practiced, and especially in a family unit, because the individuals have a similar lifestyle and similar dietary sort of style, their system could be sort of in a sync. Despite that, when patients are treated, they are treated individually because of their other tendencies, such as their outlook, their way of thinking, and so on. So we look at the family history, we look at the living style and so on, but also we look at the individual's nature, his or her behavior and so on.
Thank you. My question is regarding the wind energies you talked about, and would that be equivalent to what we describe in Western medicine as the alteration in microbiota? Microbiota is the microorganisms that live within us and control our immune system, enhance it, and if it's altered, it contributes to disease. So in your thinking, would this wind alteration or wind energy related to microbiota imbalance?
Lungi Krishnara, the Nujogi Menalola, the Kasore, organism, microorganism, Tassing Saura, Simangu Shuji or Konzu, any Tubalatini, any Lunasana immune system, Jobuchai, and the Shigura, Dida and Lungi, Lungagi Todanchigura, the Nini Parala, Tabuyanas.
Jidang peveme nanglo la lungsin, tisin, taksin, pesin, singin shegi yores. Lungsin, taksin, pesin, shegi yores. Ina yang dige changman lo simbu jigi koni shewa ina simbu jedi shidong silabres, luna la yores. Simbu jedong shigi dige changman lo lesu rungba ina ani sukula pendo che da autoimmune system pena 8 ki nazi di nadi zamba 8 ki virus di la ani contradiction di ani nanglo simbu di ani tapki yorese da nanglo simbu di chomgu yorese keje chi shese yores ine ya lung singin di inji minji di simbu chipo ji la ma ho wa ji lung singin di ngaran zo pepe su ni shewe ina ta jungwa ngale teni lung le teni jungwa tuba ani kasa 도자라 되는 롱 깨봐 딘데게 돈의 롱세 등아디 아니 가서 그렇고 랑신도 내봐이나 아니 미수고 나로야 삼로당 투비에 템버세보 용에 레버 구조자에 수부 구조자에 베네타지 라바네 손지 롱기 첼레디 아니 레버랑래야 첼레시도 좀 미수고 나로야 지 땅지 지에도 수고 대단 용에 내가 정말로 롱 손지다 아니 캡제 소소소기 내니 소소기 수분하리야 젤레 지교어레스.
In the Tibetan medical system, we sort of identify 84,000 microorganisms within 84,000 types of microorganisms within our system, and and these some of these reside in blood, and some of these reside in in phlegm and other parts of the, in the blood and so on. So when these microorganisms are well balanced, then we enjoy good health. But when we talk about the wind energies, the 5 wind energies, these wind energies, they circulate throughout the physical system. For instance, the life-sustaining wind has a huge sort of influence on the brain and the nervous system, and our sort of the pervasive wind. Sort of the pervasive wind, it influences the heart and other visceral organs. So I think we have to look at these two as impacting each other, but not entirely as similar.
Thank you, Dr. Tamdin. This was extremely interesting. So I am a professional speaker in the subject of cross-cultural collaboration and competency, and so I'm very interested in the cultural aspect of this. And I wondered, what are the primary Tibetan cultural values that impact the way the Tibetan medical system and practice works?
시라테도 그러와. 다디가는 야 최고 돈에 아니 미기 줘봐 주에 미기 때 딕바마서야. 딕바마서는 아니 미래야지 내나도 망부지 딘델레데니야 랭님베기 나미 투기 아니 소소기 지요와. 아니 잠든 닝지고 메시지로도 계시 무시가 하고도 암지지 미찬이 잠든 닝지싱도 인지미지 그거래서 암지디 슝장버레스 이내야 잠든 닝지 메나 암지디 내가 도든지 두고요 말이야. 하나지 네벌에 잠든 닝지 구고요. 그래서 네버 코나라는 게 잠든 닝지 구미 소소 나자디 아니 소소 찍볼라 여버 내수디 아니 자타고 멤버제 코란을 셴비 미망부지로야 딘데 나절레 슈크체 여버이나 섬제 소소소 마셈나 동에다 아니 가게다 디마 짜고야디 빼면시기 계신 분 디게디 상말로 용세 시조디 단 남주기 따둑다 남주야고 장에다 아니 미세들레 소남생이 지고라
In the case of Tibetan medical practice, one of the strongest influence that we receive from Tibetan culture would be from Buddhism, Tibetan Buddhist philosophy. For instance, the fundamental sort of belief in the Tibetan medical system is that the diseases are, as I mentioned earlier, caused by karma, previous actions, which are a result of ignorance. And so the cultural practice of this religion can impact the behavior of individuals, behavior of people, such as refraining from engaging in negative deeds, such as killing and stealing, sexual misconduct, and so on. And then we also talk about diseases that are karmic in nature, and these diseases are these diseases can only be overcome through the practice of engaging in positive actions. Another major impact from Buddhism is its preaching or teaching of the practice of compassion and love. As for a doctor, studying the medical text is important, but also, as important is the practice of compassion and love. These Tibetan doctors, are highly encouraged to, practice compassion and love. Similarly, for patients also, patients are taught to, practice compassion. And the practice of compassion can help in alleviating at least the mental disturbance that are caused by one's physical sickness. So the practice of compassion and love are prescribed not only for the doctors but also for the patients as well, in reducing self-centered thoughts, ego, in bringing down ego, or and so on, the other afflictive emotions. So these are some of the cultural impacts that we regularly encounter in our practice. Last question.
My name is Hollis Johnson, and I have asthma. So my question is, can you suggest any Eastern medicines or treatments to help asthma?
Okay, yeah. When I was in Delhi, I see a lot of people who has this problem, asthma, bronchitis, bronchial allergy, bronchial pneumonia, and for the small kids like your age and below your age. But there are some medicine, but more than the medicine, you have to take some care with your food and lifestyle. What you have to do is don't take anything which is too cold, chilled, ice cream, and also like sweets, potato, chips. These are the main cause of your asthma, because when you get flu, the infection causes you this problem in your lungs and you are not able to breathe. Then sometimes you have a lot of wheezing, then you have a fever, then you had very complicated to take the breath. So good to do some exercise like breathing exercise or skipping or swimming in a warm water, not very cold water. And then cycling, morning half an hour for cycle, and then avoid to sleep late, get up a little earlier, and then be calm, little bit calmer than before. If you are very angry, you are very sensitive to everything. So allergy could be also when your body become very susceptible. So this is more with the mind also. If you are cool down, your mind is better, you will less have an effect of the allergic and flu and cold. So there are some medicine also which you can take, but this medicine in the West you can take sometimes like inhaler. This is very good, especially immediately when you take inhaler, it doesn't go with the blood, it will just go to your lungs to open the lungs. But in Tibet we call like dry grapes, white one. We have special medicine made from that. We call it Gundum 7. Resin.
White resin.
Or sometimes you call resin, or we call dry grapes. But it is formed in the white and black. The white one is better than the black one. So when you take 3-4 pieces of that every day, it helps you to retain from the flu. It will also retain from your asthma attack also. Okay?
The preceding program is copyrighted by Emory University.